So drink plenty of water. Got a stuffy nose? Nasal congestion can contribute to snoring. Use saline nasal sprays or decongestants to relieve congestion. Good sleep hygiene is essential. Establish a regular sleep schedule, create a comfortable sleep environment, and practice relaxation techniques before bedtime. Over-the-counter nasal strips or nasal dilators can help widen the nasal passages, reducing snoring. Oral appliances like mandibular advancement devices or tongue-retaining mouthpieces can help keep the airway open. Finally, if snoring persists or it's accompanied by symptoms like excessive daytime sleepiness or gasping for breath during sleep, consult a doctor. Persistent snoring may be a sign of a more serious sleep disorder like sleep apnea, which requires medical evaluation and treatment.